Hello, Sam. How are you today?
Hey Clint, how you going?
I'm well, thank you. So
Good,
today
good.
we are talking about bunions. Now, I will
Yeah.
confess, I know very little about bunions. I hear people talk about their bunions and things like that, but it seems I've been fortunate enough to not have them. So I guess the first obvious question then is, what are bunions?
But bunions are it's a very interesting one. Bunions. It's you don't really think too much about them until you obviously see them or you get them yourself or you know someone with them, like you're saying.
Mm.
But they're essentially it's a structural deformity around your big toe where you
So it's always
it,
your big toe, is it?
it's always your big toe,
Okay.
predominantly your big toe. You can get them on the little toe as well, on the outside of the little toe.
Hmm.
Very lower, a much lower prevalence of that, but that's called a tailor's bunion. So that's around the fifth toe,
Okay.
but predominantly we see them around the big toe. So it's it usually presents as a widening of your sort of forefoot, where you get a little bony growth on the inside of your big toe, at the big toe joint there, the first metatarsophalangeal joint, and it basically looks like your foot's going out at the MTPJ, or that metatarsophalangeal joint, and your big toe is moving in, so towards your second toe. It's a very weird one to sort of describe without a picture, but
Hmm.
basically your big toe moves in towards your second toe,
And when you say it
and
moves in, does it
the
move
long
in
bone
that
moves out.
way, or does it move in like that? Like, does it start to lean in, or does it sort of translate?
No, it starts to lean
It's
in.
leaning in,
Yeah,
right? So your big toe
yep,
is now
yep,
pointing towards your second toe. And
yep.
sorry, and you said that was because of a growth on the bone within the toe. Is that correct?
Not because of a growth,
No.
but part of the condition, part of the deformity is that you do get a bit of bony growth on the inside. So the technical term for it, or the medical term for it, is hallux abductovalgus, which
Mm-hmm.
means the hallux is your big toe,
Mm-hmm.
and abducto means it moves in, it abducts away from the midline of the body, for example. So
Mm-hmm.
that's where I was saying it's moving towards your second toe,
Mm-hmm.
and valgus, it rotates a little bit as well. But
Right.
the essentially what you're looking at there is it's a misalignment of that big toe, and part of that, it's a very complex series of events, but part of it is that you do get a bit of bony growth on the inside. So towards, when I say the inside, uh, if we imagine it as a forefoot and then your toe. So the forefoot is the long bone, the
Mm-hmm.
metatarsal bone. So that one moves towards the midline of the body. So
Mm-hmm.
it effectively makes your forefoot wider.
Mm-hmm.
And then your toe, the big toe, moves away from the midline of the body and moves
Mm-hmm.
towards the second toe.
Right.
So you get this little triangular sort of
Mm-hmm.
growth. And then that is what gives you that the width of the forefoot increases. So you get a
Mm-hmm.
wider forefoot.
Mm-hmm.
And then around that bone, the metatarsal head there, the metatarsal phalangeal joint,
Mm-hmm.
where the toe and that long bone join, you
Mm-hmm.
get a little bit of bony growth there, which again makes it a lot wider again. So
Gotcha.
it's just a condition where we start getting more deviation and more misalignment, and it can be classed as it's usually classed stage 1 to stage 4, stage
Mm-hmm.
1, stage 2, stage 3, stage 4, or a mild, moderate, severe condition. And that's basically to do with how wide your foot's getting, or how much
Mm-hmm.
deviation we're getting, the angle
Mm-hmm.
that we're changing there, and how much that toe is moving in towards the second toe. So,
Mm-hmm.
for example, at the start, it might just be a small little bony growth
Mm-hmm.
and a small little deviation. Your foot gets a little bit wider. The toe hasn't moved too much. As we get more into the stages and the severity of the condition,
Mm-hmm.
then that toe will eventually, touch the second toe, and
Mm-hmm.
then at the final stage, it can even move that second toe out of the way and overlap, and the second toe would overlap the big toe, for
Hmm.
example.
And what causes this?
There are many causes with bunions, and it's one that I think there's probably about 10 or 11 different causes of that. And that's a long way of saying that we don't actually know there's one specific cause for it. But we do know there are a lot of things that predispose you to bunions, and there are a few big ones. The biggest one is hereditary. So it's a genetic predisposition to it. So it's not that the bunion itself is hereditary. So, if you have one,
Yep.
it doesn't necessarily mean that, further down the line, someone's going to get it, like you would pass down your eye color, for example. But it's the the set of parameters or the conditions that would cause a bunion pass down, and that could give you more chance of developing a bunion. So if it's in the family, you've got more chance of developing one, but it's not something that's necessarily passed down.
Gotcha. So yes, I don't think any of my relatives have them, so that's probably why I'm so ignorant on the topic.
So you should be good.
So let's say you do have family members who've got that. So I guess now, what are some of the other contributing factors?
Yes. So the other contributing factors would be the biomechanics. So the way your foot moves. So there are different foot postures and different foot movements. The biggest one that we normally see would be pronation or excessive pronation, flat feet, that sort of thing, collapsed arches. That can lead to certain biomechanical sequences that predispose, if you have that genetic predisposition, that will lead towards that happening. And the other one that's really interesting is because we see this a lot more in females than males. Probably the last time I remember checking, it was about a 3 or 4 to 1 ratio. And the reason why we suspect that's the case is because of the tendency for females to wear narrow fitting footwear. So, your high heels, that sort of shoe, where it sort of exacerbates that joint position that we were talking about before, where the big toes moving towards the second.
So just to double check on that one.
So footwear's a big one.
Yeah, so it's the narrowness of the footwear as opposed to high heels.
Yes, not so much the high heel itself.
Yeah.
It's more the narrowness of the footwear that we think has to do with the that exacerbation of that position.
If you've got a tendency to do that and then you start binding your feet, it's okay.
Yeah.
So I guess here's a question for you. Are there any groups of people who just never display bunions?
Never display bunions?
Yeah, you might not be aware of the research, but for example, people from tribal societies around the world, have they just never heard of bunions, for example?
I'm not sure. It's an interesting question. I'd be lying if I said I know of of some research that shows that no one's heard of it in some societies, but I'm sure there would be some that are less prevalent than others, of course, because they, like we're saying, a lot of the predisposing factors are biomechanical in nature, and that would be less so in some cultures than others.
Yep.
And obviously footwear is a big one as well. So there are some cultures that, footwear that, narrow footwear would be a lot more common in their dress and their society, their culture, than others. So there definitely would be, but I'd have to get back to you with
what we'll do is,
it's an interesting one.
After we post this video, in the video description, if we do find any references on that from Google Scholar, anything like that, I'll make sure I add the URL to the video description.
Good addition.
Yeah. Gotcha. Okay. Now, are there any other contributing factors that you're aware of?
They're the main ones. The hereditary one, obviously, you can't do too much about in terms of correcting or managing for it, other than knowing that the biomechanics or the things that are passed down in terms of flat feet and different foot posture parameters, they can be changed. But hereditary stuff we can't. You can't play too much with. But footwear and biomechanics are the two major ones that you can change, and definitely that can. I guess you can't reverse a bunion technically.
Oh, okay.
And you can't, usually, unless you get it very early, and you can reverse a little bit of that soft tissue change. But you definitely can manage a lot of these parameters and try and arrest the development, or at least slow down the progression of a bunion. It's not guaranteed to work, but we do work a lot with that sort of thing to try and stop the progression of that if we get it early.
Gotcha. So if you start to detect a bunion, and you see that your foot's getting a little bit wider and your toe's starting to kick in a little bit, then I guess don't wear constrained shoes. Go see a podiatrist straight away, see if you're pronating or anti-pronating, something like that. Make sure your biomechanics are good. So they're the first things you would do. So let's say you've done all of that, or maybe you haven't done that, and you've ended up with more developed bunions. How do we treat them?
Well, it's an interesting one in that like we were saying, you want to manage what's causing the bunion. You want to manage the predisposing factors that you can, whatever you can. You tick as many boxes as you can, basically, to try and stop the development of that. And that obviously depends on when you get it. The issues with bunions are, most of them are conservatively managed, in that you can get two types of pain with bunions. One is usually on the outside of the joint, and that's, where, because we're saying your foot turns from a a straight midline there. It turns, on the inside there, it turns into this triangular sort of deformity that we get where we've got a bit of excess bone there and we're getting a bit wider. We can get a lot of rubbing from footwear. And so people often complain about pain on the outside of the bunion where it looks like it's red and angry and could become a bit swollen, and you can get some bursa around there, blisters, things like that. And so that's usually caused by footwear, ill-fitting footwear. And as your foot gets wider, as you can appreciate it, it's a lot harder for people to find footwear that's going to accommodate that.
Have to get some custom shoes.
Yeah. So it actually does go that way, So it goes into, we get some wider footwear initially. Footwear comes in different depths. You have different materials around there. You can change the lacing pattern around the footwear so that you can accommodate a wider foot, in the shoe. Then you can get to custom footwear as well. Obviously, if that, it gets to a certain point where so that's all conservative management. There are things like sleeves that you can put over the bunions, gel sleeves, protectors, if you like.
And these are basically anti-friction devices, so the shoe's not rubbing. Is that correct?
Yeah, anti-friction and anti-pressure as well, trying to absorb the pressure and trying to separate the shoe from the foot.
So in that context, the bunion itself isn't really the problem. You're just rubbing on the skin very hard, and that's obviously irritating the skin. In
that case, yeah. So in the case of pain on the outside, absolutely.
Yes. And so obviously there's another one here. Yeah, what's the other one?
There is another one. Yes, there's inside pain then. There's the joint pain. And so with the outside pain, it's a lot of it is conservatively managed like that, around footwear, around protective devices, things like that are designed to cushion. The inside pain is more the mechanical pain. So it's how the joint's moving, because like we're saying, it's not just that the joint is enlarged or widened, or the forefoot's widened. It's that at its core, it's a misalignment of the joint. So it's not moving well, and in many cases it can develop arthritic sort of change inside that joint as well. And if the joint's not moving well and we're getting some pain in the joint with every step we take, it's a bit more unstable. You can get some other mechanical issues that will give people pain, and that's where the trip to the podiatrist is a good one, because you get the you can correct those mechanics or manage those mechanics with things like insoles, whether it be off the shelf or customized insoles, and that will try and put the joint in a more congruent position or a more efficient mechanically, and that can help with that sort of pain. And so it's often a combination of the two. It's a change in footwear or an accommodation in footwear, whether it be you're using an accommodative device like a sleeve or a protective something that you can have inside the shoe, and correcting the actual position of the foot, or trying to put the position of the foot such that it's making the pain a little bit more comfortable. So we're managing the pain. But two, the bigger one is that we're trying to stop the conditions that are going to cause that bunion to develop further and progress quicker. So that's where we were saying before, conservatively, if we can slow that down or arrest the development of the bunion as best we can, then we're doing the best.
And that's the treatment at the moment.
So
I guess that's interesting. So a lot of it is prevention, and even when it's progressed, it's still preventative techniques to make sure it doesn't get worse, and also to, I guess, mitigate those symptoms as much as possible. So there's no sort of surgical treatment or anything like that? You can't?
No, there is. There is, yeah. So surgery we often reserve for cases where conservative, management has been exhausted. It's not really going the way, or we've got it too late where we can't really get enough of a benefit for that person in terms of pain reduction or lifestyle choice. For example, if you're getting blisters every time you're wearing your shoes and you can't, get around and do things, you're in too much pain, then we would look at surgery for that person. And there are times when people just don't like the look of the bunions, for aesthetic reasons, things like that. But typically speaking, most of it is conservatively managed, but there is obviously surgical pathways as well for people that we determine either pain-wise or lifestyle-wise if it's affecting them in a certain way. Very, very commonly, we would see, people that are wearing shoes getting blisters, and that can lead to other complications. Those sort of people, we would sort of say, okay, well, maybe surgery is a better way here. And
I'm imagining surgery on your foot's a fairly serious thing, is it? Because, obviously, you're going to be off your feet for a while. You're going to be pretty much bedridden. How successful is the surgery if you do have to go down that path?
It's pretty good these days.
Okay.
And surgery, they can do it with minimally invasive techniques these days as well. So surgery these days on bunions is not something that, it's a we try and avoid at all costs sort of thing. It's, it's there if we need it, and we do recommend that to a lot of people. But it's like we're saying, it's mainly dependent. It's very specific to the person and their lifestyle,
Gotcha.
because of the complications of surgery and the fact that sometimes, unless, sometimes there's different types of surgeries as well. Sometimes they can just clean the joint out, they can realign it. Sometimes they pin the joint together, depending on the condition of the joint. If they do things like that, obviously that's going to have ramifications for the person moving forward. So we have to consider that in the context of the person. And that's why most cases, if we can resolve or we can manage their complaints in a conservative manner, then we would much rather do that.
Yeah, and that makes sense.
And in most cases, we can. In most cases.
Oh, very good. So if somebody does have a bunion,
and
assuming it's not an extreme bunion, but the majority of bunions, a person can still walk around quite comfortably. They should. It shouldn't be limiting much of their lifestyle or anything like that. They should be able to do what they were doing before the bunion anyway, and their big toe can still sort of move up and down and do what it had done before, just at a bit of a different angle. Is that fair to say?
If they've got the bunion, you mean, and they haven't had too many. So if they've got a bunion and their big toe moves up and down relatively freely, they don't have too much pain, then most cases like that, the pain would be on the outside of the, it would just be related to footwear. If we haven't got any mechanical sort of joint pain, then it's mainly, we mainly focus our treatment around making the footwear accommodate the foot. And, whether that be with, like we said, the use of, protectors, sleeves, things like that, we can do that. There are certain devices that try and, splints for bunions as well that you can wear at night that temporarily provide a little bit of relief as well. And so some people are using those sort of things.
So that's not to reverse the bunion. That's just to help take a bit of load off the joint.
Yeah, exactly. It won't reverse it. It won't reverse it. In our experience so far, anyway, we haven't seen anything that can reverse that because of the amount of force that you need to do that, and for the amount of time that you need to do that. Unless it was something very mild, and you got it very, very early on. But in most cases, it's manageable, and that's the biggest sort of take-home message, is that if we know what's causing the pain, if it's an external pain and it's footwear related, and we can manage around that, then most people are very comfortable with that sort of treatment. And at the same time, if we can arrest the development or stop the progression of the bunion through things like orthotics, things like that, and footwear, then in most cases we can get a successful sort of outcome with that treatment plan.
So I think just to summarize, so bunions, it's a hereditary thing. Very much a hereditary thing. However, it's exacerbated by other factors such as the nature of your footwear and the way your foot moves. It is basically the long bone in your body going in towards the inside of the body, and your big toe starting to point away from the inside of your body. Can be true. And one of the major issues is the outside pain, just footwear. Inside pain is probably more a case of the way you move, your foot position, stuff like that, and each of those can be treated by the insoles, changing your footwear, things like that. And that's usually quite manageable. Worst case scenario, might have to engage some surgery.
Worst case, So surgery is an option. Surgery is an option for people, and unless it's something that's causing a lot of pain or anxiety and things like that, then conservative management is most likely the way to start, and it's very successful for most people.
Very good. Anything else on bunions that's worth knowing at this stage? And I will do my best to find that article and put it in the description.
We should find that. Yeah. No, it's that pretty much covers it. Like I was saying earlier, it's more it's depending on where the pain is, whether it's the inside or the outside of the joint, and then looking at conservative ways to sort of manage that. And the biggest takeaway, I guess, is to try and get it early, because the earlier you get it, the less obviously you've got the deviation or you've got the misalignment, and then the less likely you're going to have more complications with footwear
So there's probably something I didn't say earlier, but like if anybody's watching this video just because they thought, maybe my toe's pointing inwards or something, it's like, am I getting a bunion or not? Like, go see a podiatrist, like get something done straight away. You don't want to leave that, because once you do it, much harder to go back. So you're better to err on the side of caution when it comes to bunions.
Exactly. Yeah. If it's something that's early on, it's a lot easier managed than the further it progresses.
Done.
Absolutely.
Excellent. Thank you for your time, Sam.
No worries. Thanks, Clint.